Sector 69 in Gurugram is a highly saturated diagnostic market. You have MaxLab, SRL, and Pathkind, corporate testing chains competing on nearly every corner. Tucked inside Dharam Raj Plaza is Dr.Yadav PathLab. They have operated in this exact neighborhood for 25 years as an independent healthcare provider. Despite being a local 24-hour clinic, their operation has serious scale. They process a catalog of over 5,000 distinct medical tests. This setup creates a rare hybrid for the consumer. You gain the physical accessibility and institutional trust of a neighborhood clinic, backed by the testing capacity of a corporate hospital. A menu of 5,000 tests creates an immediate problem for the patient. You have to mathematically choose the right diagnostic panel without overspending or missing a crucial health marker. This chart plots diagnostic value against cost and effort to illustrate the psychological trap of parameter bloat. Marketing teaches us that testing more variables automatically equals better healthcare. The data shows a different reality. A basic 10-parameter test provides high immediate value for a very low cost, establishing a solid baseline. If you push that to 149 parameters, the actual health value plateaus. Meanwhile, the financial cost and the effort required from the patients skyrocket. Medically, testing too many irrelevant variables introduces the risk of the incidentaloma. This happens when a lab finds a minor, totally meaningless anomaly simply because they cast too wide a net. Diagnostic quality requires buying the exact signal for your specific body, rather than paying for the highest number of data points. The heaviest option on their menu is the Master Health Checkup Complete Care Package. This package demands strict inputs. It costs 7,495 rupees, requires a strict overnight fast, and needs both blood and urine samples. The output is a massive 149-parameter dataset. It maps out nearly every organ function, hormone level, and vitamin baseline in your system. Handing over 149 data points drastically increases your probability of triggering an incidentaloma. Chasing down a single minor, out-of-range metric often leads to unnecessary follow-up specialist visits and severe anxiety, usually without improving your actual health. The Master Checkup serves as a highly specialized data-gathering tool. It is best reserved for patients who need an exhaustive biological reset, rather than a casual annual screening. The mid-tier alternative relies on targeted profiles. The JANCH series zeroes in on specific issues like diabetes, thyroid function, or PCOD and hair fall. These profiles range from roughly 2,000 to 6,000 rupees. Instead of 150 metrics, you get a tightly focused cluster of 40 to 70 related parameters. The return on investment here is high. You receive highly actionable data, perfectly tailored to a known symptom you are already experiencing. The primary trade-off is the medical blinders effect. By focusing entirely on one specific region, you might perfectly manage your hormone levels while completely missing a quietly developing renal or cardiac issue. Targeted profiles act as highly efficient diagnostic weapons. They require you to already know exactly where to aim. Testing quality also depends on how the sample is collected. Through a partnership with ThyroCare, the lab offers a free home sample collection service. The conveniences are massive. You eliminate the commute, draw the sample upon waking, and get a 29% discount. The hidden trade-off lies in the chain of custody and the environmental variables introduced during your sample's transport. At-home collection removes the patient from the highly controlled, 24-hour physical clinic environment of Dr.Yadav lab. You lose the ability to ask spontaneous face-to-face questions with senior diagnostic technicians while the blood is being drawn. At-home testing prioritizes scheduling convenience, trading away the absolute environmental control of a 25-year-old physical lab. This matrix shows how to map your specific life and health profile directly to the exact package you should purchase. First is the baseline builder. This is a generally healthy adult over 30 with no known issues, looking for a standard annual checkup. Choose the Complete Body Checkup Wellness Pro. At roughly 2,628 rupees for 96 parameters, it hits the mathematical sweet spot and avoids parameter bloat. Next is the Symptom Solver. This patient is experiencing specific acute issues, like severe fatigue, sudden weight changes, or noticeable hair loss. Ignore the generic full-body packages entirely. Buy the targeted judge profiles to get the highest return on solving your specific problem. Finally, the time-poor professional. The absolute biggest hurdle to maintaining your health is finding the time to schedule the appointment. Rely entirely on the home collection service. You utilize Dr. Yadav's institutional backing for peace of mind without ever leaving your house. Navigating the hyper-saturated Sector 69 diagnostic market requires ignoring the marketing hype that more parameters equal better health. The true value of a blood test lies in the precise accuracy of the questions it answers, not the sheer volume of blood drawn. The best diagnostic experience perfectly aligns the scale of the testing with your